Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to talk about a condition called brachycephalic ocular syndrome. So brachycephalic ocular syndrome is a condition which we see in short-nosed patients. We call them brachycephalic breeds. And it's a combination of different factors. So it's a combination of having poor eyelid conformation, very exposed eyes, very shallow orbits, and a very, very short nose, which can have impact on the surface health of the eye. It can happen in dogs and as well as in cats. In dogs, we tend to see it most in pugs, in French bulldogs, in Lhasa Apsos, in Shih Tzus. In cats, we predominantly tend to see it in short-nosed patients such as Persians and British Shorthair cats. Well, unfortunately, it's breeding. It's the way that these breeds have gone. They were bred to have shorter and shorter noses, to have these very exposed, very wide open eyes, to make them look um, more appealing to certain owners. But unfortunately, it's come at a cost to the patient in the sense that they're no longer able to, um, in some severe cases, to completely close the eyes. And they have chronic exposure of the surface of the eye. They tend to have very poor tear film as a result of that. And as a result of having poor tear film and a poor lid conformation, we oftentimes see these patients with very, very nasty surface problems on the eye. So corneal ulcers, melting corneal ulcers, deep corneal ulcers, and they can progress and get very, very bad very quickly. So the breeds which are predisposed to this are pugs, Shih Tzus, Lhasa Apsos, French bulldogs, and in cats, mostly Persian cats and British Shorthair cats. But um, there are a few other crossbreeds which can also suffer from similar conditions. But these are the most common breeds that we tend to see with this condition. Yes, and because of the breed, the facial conformation, both eyes usually are affected. They might not be equally or symmetrically affected, depends on the situation, but they will have a degree of this on both eyes. So unfortunately, we can't give these patients a new face, but what we can do is try and improve the tear production, and we can do that with medication. And we can try and help improve their eyelid conformation by doing corrective lid surgery to minimize exposure, bring the middle part of the eyelid, which is oftentimes behind the equator of the eye, which makes the eye protrude so much, and try and bring that forward to help minimize exposure to the eye. The procedure is called a so-called medial canthoplasty procedure, and is a very common procedure that we tend to do in combination with other types of procedures in these breeds, should they have to undergo a general anesthetic. The main thing for these patients is that brachycephalic ocular syndrome can also be associated with other um, problems to do with their brachycephalic facial conformation, and that would be brachycephalic obstructive airway problems. So these patients may need to undergo a multidisciplinary approach where a soft tissue surgeon may have to help improve their upper airway conformation, and we have to try and help improve the eyelid conformation and help improve the tear production. So although many of these patients walk around without ever even seen a vet and might never have a problem, the ones that we tend to see in practice are the ones that do have problems, and they tend to have very severe problems, and they can have recurrent problems. So, and if you've already had previous ocular surface problems such as ulcers or other issues, if you leave those untreated, they're probably going to recur. And if you're unlucky, an ulcer which may be very simple and superficial to begin with may become very deep very quickly, and worst case scenario lead to loss of the eye. So it's a condition that if they have symptoms, you do not want to ignore. So hopefully you found this information useful. I know that this is a very controversial issue to talk about, but if there are any comments or any questions, please feel free to drop those below. Thank you very much. Bye bye.